Although there are many types of research studies, for this project we have decided to focus on cohort studies. A cohort study is a type of research study that investigates the cause of a disease while attempting to establish links between various risk factors and different health outcomes. In this presentation, we will discuss the differences between prospective cohort studies and retrospective cohort studies. We have also decided to include an example of each so you can see how they work.
A prospective cohort study is a study that takes a selected group of participants and follows them over time. In the beginning of the study, all participants are disease-free. The researcher then divides the participants into those that have been exposed to a certain variable and those who have not been exposed to it. The participants are then followed over time to see which ones develop the condition of interest. This type of study is observational, not experimental.
An example of a prospective cohort study we found that was dental related was a long-term implant prognosis in patients with and without a history of chronic periodontitis by Carusis. It was a 10-year prospective cohort study that compared the failure and success rates between patients having lost their teeth due to periodontitis and for other reasons. The researchers took baselines for all the subjects involved in the study and followed them over a 10-year period to see if subjects with a history of periodontitis would develop the condition and observe how it would affect their implants over that span of time. The results showed that the survival rate of the group with the past history of periodontitis was 90.5%, while the survival rate of the group with no past history of periodontitis was 96.5%. The study showed that patients with a past history of chronic periodontal disease had lower success rates than patients who had lost their teeth for other reasons. But the clinical implication of these findings is that implants are a reliable long-term treatment plan for both patients with and without chronic periodontal disease due to their high success rate overall. This is a great example of a prospective cohort study and how it should be carried out.
A retrospective cohort study is a study which starts with patients already having developed the outcomes of interest. The researcher looks back in time longitudinally and selects exposed versus non-exposed groups based on existing records prior to the occurrence of the outcome of interest. So, the direction of inquiry in this type of study is from exposure to outcome. Retrospective cohort studies are efficient for studying rare exposures as well as diseases with long developmental times. They offer the advantage of speed and low cost compared to prospective cohort studies. However, retrospective cohort studies also have the negative potential of recall bias.
An example of an RCS pertinent to the dental profession is Michael Bates' 2004 study entitled Health Effects of Dental Amalgam Exposure. Bates and his team set out to determine if amalgam fillings can be associated with nervous system disorders and kidney disease. Their study looked into 20,000 members of the New Zealand Army between 1977 and 1997, checking health and dental records for a correlation between amalgam restorations and disease. The results of the study were for the most part comforting, as no association was found between amalgam fillings and chronic fatigue syndrome nor kidney disease. What's more, the association with multiple sclerosis was only minorly correlative. The study is an excellent example indicative of how RCSs are valuable tools for medical and dental research. For further information, please view our Works Cited page. The squad.